So I'll first give you a scope and overview of the Saudi-based contributions, then talk about the research landscape and collaboration landscape, then the distribution of Saudi-based abstracts by research team, and then highlight the key strengths of the key scientific strengths and future research priorities built on these strengths. So this presentation will be summarizing the Saudi-based abstracts presented at the Liver meeting from November 7th to November 11th in Washington, D.C. And all abstracts were identified based on the Saudi institutional affiliations, either as primary or collaborative contributions, and only a subset of these abstracts will be selected to illustrate key thematic areas. Saudi-based investigators contributed to 41 abstracts in total, and these abstracts were not developed in isolation. It reflected a strong national collaboration, and key institutions that participated were King Faisal Specialist Hospital, Ministry of Defense Health Services, King Saud University, Al Faisal University, KMARC, Ministry of National Guard Health Affairs, and the Imam Abdurrahman bin Faisal University, expanding to international partnerships with centers in the United States, Europe, and the Asia-Pacific region. This shapes Saudi-based research not only as a contributor, but as a partner in shaping global evidence. The biggest proportion of these abstracts were under the metabolic liver disease, with almost 50% of the abstracts were based on metabolic liver diseases, followed by liver transplantation, pediatric and genetic liver diseases, and followed by hepatocellular carcinoma. Equally important was the methodological strength. These abstracts were developed from perspective-based populations, multi-centered prospective studies, and implementation-focused research. I think something's wrong with the... Okay. I'll start with the metabolic liver disease, which was the biggest chunk of the abstracts. In particular, the Genesis prospective population-based cohort study. It provides one of the most robust national assessments of muscle to date, and they estimated the muscle prevalence in 3 primary regions of Saudi Arabia by using clinical, biochemical, and FibroScan imaging data. And they found that the muscle prevalence was almost 37% in nearly 3,000 Saudi participants. Followed by hepatic steatosis, it was present in 70% of these patients, and significant fibrosis was only observed in 3%. So this tells us that MASLD represents a substantial population-level health burden, mainly driven by steatosis, giving us a critical window for early detection and prevention. As you can see here, the MASLD prevalence was increasing by age, and the prevalence was consistently higher in males than in females. But the burden of disease was evident across all adulthood groups and not only limited or confined to older age groups. And this highlights the importance of earlier screening strategies of MASLD. What makes this theme particularly strong is that it did not stop at prevalence. One multi-centered prospective study asked a very practical question. Can we scale high transient elastography, high quality transient elastography beyond expert operators? And they developed, and the group of gastroenterologists and hepatologists developed a standardized protocol across multiple healthcare centers. And 9 healthcare workers received hands-on structured training by 9 certified supervisors. And each trainee had to complete 100 supervised, followed by 10 independent measurements. During this independent phase, supervisors performed parallel blinded assessments on the same patients. So as you can see, trainees progressed from 100 supervised transient elastography measurements to 10 independent measurements, and it was all controlled under a very strict criteria. The IQR to median ratio for each measurement shouldn't exceed 30%. as well as competency was only confirmed upon achieving a strong interoperator agreement of an intra-class correlation coefficient higher than 0.80 for all LSM and CAP measurements. This showed us that the implementation of FibroScan is actually feasible in clinical and research settings. Moving on to the next abstract. Oops. Sorry. Moving on to the next abstract, lifestyle modifications remain central to the muscle management. So this study followed 79 patients who fasted for 21 days during the month of Ramadan, and they took assessments immediately before and after Ramadan ended. And these assessments included glycemic profiles, lipid profile, liver stiffness, and liver enzymes. And they found that the patients, these assessments were actually improved after the 21 fasting days. This highlights that Ramadan fasting benefits is not only restricted to reduced calorie intake. However, it likely reflects the benefit of time-restricted dry fasting and potential lifestyle modifications. Moving on to the liver transplantation theme, this retrospective cohort study took place in a large tertiary transplant center in Riyadh, and they analyzed 745 adult liver transplant recipients, and they evaluated the impact of pre-transplant comorbidity on the post-liver transplant outcomes. And they found that the comorbidities were highly prevalent in pre-liver transplanted patients, but the overall comorbidity burden was not associated with mortality. However, they found that heart failure and MELD NA score independently predicted fatalities, and sepsis was the leading cause of mortality, accounting for almost 2/3 of deaths. So this highlights the importance of pre-transplant cardiovascular optimization, as well as rigorous sepsis prevention. In the pediatric and genetic liver diseases, this poster was actually recognized as a poster of distinction. And the study included 25 pediatric liver transplant patients with progressive familial intrahepatic cholestatic disease type 2 with bile salt export pump deficiency caused by a mutation in the ABCB11 gene. They found that the patients presented very early in life with a median age of just over 3 years old, and they all came from consanguineous families. Cholestasis was a defining feature with marked high bile acids as well as bilirubin levels and liver enzymes. And 80% of these patients required liver transplantation, highlighting the progressive nature of this disease, and notably 16% developed HCC. And this describes the malignant potential of PFIC2 patients with these specific mutations. As you can see in the middle, liver and histology and imaging findings show were associated with aggressive liver pathology, specifically in this genotype. And they showed that the preemptive liver transplantation has actually reduced liver mortality rates, supporting the potential of early transplantation. The final abstract was a hepatocellular carcinoma from a prospectively maintained registry in Saudi Arabia. They included patients for 427 patients from August 2020 to May 2025, and they compared non-muscled HCC with muscle-related HCC. Their main objective was they wanted to see if muscle was an emerging etiology for HCC. And they found that in nearly one-third of this registry, patients had mast cell-related HCC. And they found that they were older at diagnosis and they were more likely to have diabetes. But there were no differences or apparent differences in the presentation of the disease, liver staging, or the treatment options. Short-term survival outcomes showed that even the short-term survival outcomes were comparable between these two groups, and this can be relevant because that means that these mast cell patients could have been identified before the malignant transformation has occurred, supporting the need for earlier mast cell surveillance. The key strengths present in these abstracts is that all these abstracts show that there's a unified research direction, and they all gives us a cohesive narrative of the liver disease spectrum. One of the key strengths was some of these studies used strong use of transient elastography, in particular FibroScan, serum scores, and comparative diagnostic frameworks within MASLD. And there was a high quality real world data characterizing HCC etiologies, MASLD related and many others. And there was a presence of large nationally representative cohorts, as well as implementation of translated, validated muscle diagnostic tools integrated into primary cares. Finally, all these studies were aligned with the AASLD and AASLD focus areas and priorities. Future research priorities are standardizing and refining non-invasive muscle assessment tools and integrating them in routine care rather just in clinical settings. The second is optimizing HCC surveillance in patients with muscle. And also to follow up and support the longitudinal follow-ups in existing cohort, because in Saudi Arabia now we have large studies with real-world and population representative cohorts. And finally, design and conduct multi-center clinical trials to assess the efficacy and safety of emerging treatments for liver disease within the Saudi Arabian population. Thank you.